Psychological health and safety in the workplace is not a yes, you have it, no, you don't have it. It's not a destination that one day you've done all this work and suddenly everybody's psychologically healthy in the workplace or the workplace is psychologically healthy. It's a process. And the changes in the organization, depending on your demographics, it may look very different in your organization today than it would 10 years ago or 10 years from now, because you have very different demographic with different needs in your organization, because maybe you have more diversity in your organization. And it will also look different between different industries. If you're working in sales or in fast-moving IT or working in mining, what constitutes a psychologically healthy and safe workplace?
Does your company see dealing with mental health in the workplace as a cost center or a cost savings? How you view it has a huge impact on what happens.
The genie is out of the bottle. This is something that has come to the workplace, not just in the terms of accountability for being supportive and not discriminating people who have been diagnosed with mental illness. It has also come to the workplace increasingly as accountability of employers look at themselves as a possible root cause. And that's what the Psychological Health and Safety Standard, the national standard, is all about. The idea that you as a workplace could be held accountable for the mental injury that you have on your employees. And there's a lot of reasons why this discussion has been happening and why employers are increasingly being brought to the point where they need to look at themselves and not just say, well, you know what, you're having difficulty. Here's your EAP. Go and take care of yourself. Go take care of it. And it's gone from legislation that started with things like you're not allowed to abuse people with bullying and harassment or violence to people have a right to a healthy environment. People have a right to be treated with respect. These are the 13 characteristics of a psychologically healthy and safe workplace. And as I said, you will have some in your organization. Some will be strong, will be less strong. But ultimately, all of these need to be observable in day-to-day life. What happens when I meet Ron, how I treat him, how capable am I of communicating effectively. These are the kind of things that will affect all of these. These are the characteristics, but on an abstract level. You keep going back to those 13 characteristics, and you're going to change. You can use those questions that come up and how that relates to things that are changing. You could bring it in town halls. Some companies have town halls. Some have health fairs. Bring in something around, even if it's a piggyback on a campaign around diabetes. Talk about the mental health impact. So it's not always about improving mental health. It's also about creating awareness by bringing it up, by acknowledging it, and by repeating the message over and over that this is important, that it's normal, and that it's acceptable.